All right, topic that's near and dear to a lot of folks, obviously. So, are you a hospital inpatient or outpatient? Has anyone found that confusing lately for you or your family? Okay, it is definitely a topic to look at. And why? Well, it's very controversial. So I know if you watch the evening news or you see anything going on, you've had a couple of broadcasts of horror stories, really, where patients are going into the hospital and then months, it might even be 2 or 3 months later, the patients are hit with these enormous bills. And I think Brian Williams had something on a couple of months ago, probably about 4 or 5 months ago. The lady had went in for a simple procedure and ended up with an $18,000 bill when she went to rehab. So it is really hitting lots of folks across the United States, more so now since last year around October timeframe when Medicare changed the rules just a little bit on how hospitals can classify you as an inpatient or outpatient and what Medicare would cover as an inpatient and outpatient. So it's been real heavy. Of course, we're all paying more for our insurance and our copays and our premiums, so it's a challenge. There is a lot of misinformation in the media, so hopefully by the end of today you'll have some basics and that you'll be solid on understanding these issues, so you won't get caught up in those misinformation and lose that money. And definitely, we want you to be informed. So what I'm going to give you today is from Medicare. Doesn't matter if you're here or in California or New York or wherever. It doesn't make a difference because Medicare is federal guidelines. They apply the same across every hospital in the United States. Every one of the 5,700 hospitals, like our 2 here, they apply. All right, inpatient versus outpatient status. Now, really, and now I know when you're hearing in the news, you hear the word observation, and we'll talk about observation down here. But really, there's only 2 levels of care. You can only be either an inpatient or an outpatient. Now, how many of you have had outpatient services here in the last, several months? So you went for a procedure, or you okay, so that's outpatient. And then you've got your inpatient, where you're in acute care facility. So your Medicare A, this covers your inpatient. Your Medicare B covers your outpatient. This is real important because when you're an outpatient, obviously, if you don't have a supplement to your Medicare Part B, then you got 20% of copays in there. And a lot of times that's what will hit you when you get out of the hospital. Okay, so any questions about in, out, or who pays what? You pretty much got that, right? Yeah. Okay.
What would ER be considered? In or out?
Out.
Okay.
Yep. So you're just going in, you're getting services, and you're leaving. Okay. If you stay overnight in a hospital bed, are you automatically considered an inpatient? Who thinks you are?
I would think so.
Who thinks so? A couple think, but everybody else thinks no. Okay. That's right. No. A hospital bed does not make you an inpatient. Okay? Does not make you an inpatient. It's logic, right? It's exactly the Brian Williams story where the lady was like, I was in there, I went in a hospital bed, I stayed for a day and a half. What were they observing? What did they do? I was in a bed. Okay? But being in a bed does not make you an inpatient. Okay? It's not physically where you're at. It's what your care needs are and what Medicare will cover. How they look at outpatient and inpatient. Okay?
Dexter, you did have a question.
Yes, I'm sorry.
Okay, the question being, are you saying they were in a bed possibly in the ER and not in a room?
That's a good question. A bed in a room, upstairs, 3rd floor, 5th floor, 2nd floor. Okay, so ER, if you're just in the ER,
Then you're an outpatient.
you're an outpatient. even if you're up in the room, second floor, third floor overnight, that does not make you an inpatient. Your physical location, the fact that you're in a bed, does not make you an inpatient. A lot of confusion happens when you're in the ER and physicians will say, we're going to admit you. Okay, we're going to admit you. That word admit. Okay? We're going to put you in a bed. They're not saying you're an inpatient. They're not saying you're an outpatient necessarily. They're saying they're going to admit you. So it's confusing. A lot of terminology is confusing. But just because you get put in a bed on the 5th floor, the 4th floor, does not make you an inpatient. All right? And here's why.
Can I ask quickly?
Yes.
Inpatient, or we are going to admit you, is still not inpatient?
Correct. If the physician says, well, we're going to admit you to the hospital, we're going to put you up, we're going to put you on the floor, and we're going to run some tests, and that's what you'll hear. We're going to, well, we want to check the X-ray, or we want to run an MRI, and we're going to put you up, we're going to admit you up to the floor. That doesn't mean you're an inpatient.
But you're going to
Okay.
tell us how we do get to the.
That's right. We're going to get there. All right. So what determines your status? Inpatient, outpatient. Okay. Now remember, this is CMS. I don't care where you go. You leave here tomorrow and fly up to Michigan, same guidelines. Doesn't matter. Your condition and the level of care, the services you need, the intensity of those services. So y'all know if you need let's say if you need a ligament repaired in your knee, you get that as an outpatient today, right? So if you needed a knee repair, but you stayed overnight because you had a little complication and they put you up in the bed, does that make you an inpatient? No. You can get your stuff as an outpatient. So it's your condition, the level of intensity of care. Where can you be treated? That's how Medicare looks at this. What's the most appropriate setting? Now, let me tell you, one of the biggest issues that we see, all hospitals see, patient comes into the hospital and maybe has taken some falls, has a bad leg, okay? Observe, we need to get some x-rays, maybe take therapy to look at you, see what's going on. But if nothing's broken, no repair, no surgery needed, you go home the next day, do you think that requires you to be upstairs in a bed getting monitoring, getting inpatient, acute, intense services? No. You could get that therapy probably at home. You could get it as an outpatient. You could get it as a skill facility, a rehab facility. That's how CMS looks at it. Okay, so it's the care that you need, the intensity of care that you need determines your status, inpatient or outpatient. So a lot of times, many facilities, every one of the 4 hospitals in town do this. For instance, NCH, we do simple knee repairs. We do lots of outpatient surgery, but you may stay overnight. Whereas if you went to the surgical center up here, in downtown Naples, you'd be going home that day. We do some of the same services. We just do them at the hospital. Just because you're at the hospital, you stay overnight, does not make you inpatient. CMS says you could have gotten that same procedure done at that surgery center and went home at 4 o'clock that day. They close, they shut up, and they go home, and that's it. But if you have it in a facility, they deliver some of the same services. You may or may not stay overnight, but if you do, your condition doesn't. You don't require being in an inpatient hospital, okay? And CMS looks at this. There's a huge difference in what they pay and what they reimburse hospitals. Big difference. So they're not going to pay for things that you could get as an outpatient. Does that make sense? That's how they look at it. All right.
If you have a bad heart, would staying overnight, could that count as inpatient?
It could.
It could.
Mm-hmm. And we'll get that.
Okay.
Here's something Medicare requires every hospital to have, a department like mine. Okay? So Medicare is not like your commercial insurances. So if you have a commercial insurance and you want to get your knee replaced or you want to go in for a lot of procedures, a lot of times lab tests, sometimes x-rays or MRIs. What do you got to do? You got to get it pre-certified, right? You got to call and you got to ask, doctor wants you to get an MRI, the doc calls and gets it pre-certified through your insurance. Medicare does not do that. All right, so you want to get your knee replaced. You go to your doc, your surgeon, and he says, okay, we need to get your knee replaced. If you have Blue Cross Blue Shield, for instance, that staff at that doctor's office is going to call Blue Cross and say, look, Mary needs her knee replaced. And these are the problems. Can we get an authorization to do the procedure and get it paid for? Yes. Okay? You got payment coming. You go and you have your procedure, and it's done. Medicare does not do that. Medicare does not pre-authorize things. So, Medicare says, every provider, hospitals included, your doctor's offices, doesn't matter. You have to know the rules that Medicare goes by, and you've got to notify the patients. You got to treat the patients correctly, and you got to, do the right level of care for them. If you don't, we're not paying. We're not going to pay for the care. All right? So you got to know it. So Medicare requires every hospital to have a department like mine, which is required to look after your interests. So every patient that comes in, our department reviews it. What's the level of care? Get with the attending. What's happening? It's kind of a checks and balances to make sure you're put in the right level of care per Medicare regulations, so you don't get stuck with bills and these kinds of things. Yes?
Does that happen before or after the procedure?
The procedures, it happens before the procedures if they're elective. But if you come through to an emergency room, then it's going to happen after you get in there, obviously. So you come in at 12 o'clock at night and you get admitted, we're going to come by and look at you the next day.